Hey Kelly, sorry I'm late.
Okay, what's up?
Alright, you ready for this module exam?
I think so.
Okay, me too. I think I'm hopefully I'll pass. That's what's it.
We'll see. Hey man, you okay? You okay? What's going on?
What? Just a little lightheaded.
You take your insulin today?
No, I don't think so.
You don't know?
I don't know actually.
Okay.
What happened?
We're just chilling, studying. I'm gonna call 911. Make sure you're okay.
No, I'm good. I think I'm good.
I'm gonna call just in case.
Okay, alright.
Hi, yes, I would like to report my friend. He is having some confusion. He's diabetic and he's not sure if he's taking his insulin today, so I'm just a little bit worried. Great, thank you. Okay, he'll be here soon.
All units, we got a 25-year-old male. His friend states he's a confused diabetic who isn't sure if he took his insulin.
Okay, Unit 67 responding to a 25-year-old male reporting of confusion, history of diabetes. En route, will be there in 5 minutes. All right, as we get here, we have our PPE on. We're gonna check scene safety, and the scene is safe. We're gonna approach the patient.
Oh my God, please come quick. He was
What
just fine, and then as soon as I got off the phone, he fell unconscious. So I don't know what's going on.
Patient would be an NOI. Number of patients seems to be 1. No additional resources needed at this time, and no C-spine needed as well.
All right, for our general impression, our patients, we found him seated. He's unconscious. First thing we're gonna do is we're gonna check for, I see chest rise and fall, so he's breathing. We're gonna check his carotid. There is a pulse. Sir, you okay? Nothing? You have some sternum? Oh, okay. Sir, you okay? You here? What happened today? Sir? All right, okay. Me checking our XABCs now. For X, there's no obvious bleeding, so we'll move on to A. Patient's regained consciousness, sir. Okay, he can respond, his airway is patent. So we're gonna move on to breathing. My partner Nadia is gonna also take his lung sounds. I'm gonna grab the...
He has true lung sounds, so he has some shallow breathing.
Okay, so we're gonna assist his breathing with the non-rebreather mask.
15 liters a minute.
At 15 liters a minute. We're gonna move on to circulation. Be a little hard when you do this. I'm gonna check both his pulses, sir. Everything's okay. Okay, his pulses are rapid and weak. His skin is also pale, cool, and diaphoretic.
Alright, I'm checking the patient from head to toe, taking no longer than 90 seconds for my rapid exam. I see no other life-threatening injuries, so now I'm gonna be doing rapid transport, stat transport priority 1.
Okay, for our intervention, so his airway was patent. We didn't do any airway adjunct. Breathing, we're assisting his ventilations with a non-rebreather mask at 15 liters a minute. And for circulation, we are going to treat for shock, give him a blanket for thermal regulation, and transport stat to the nearest hospital.
Who you guys talking to?
Alrighty, right now we're doing history taking. Starting off with sample. Any signs and symptoms? Patient seems to have shallow breathing. He's also pale and clammy. And then, do you have any allergies, sir?
No.
No? Okay. And do you take any medications for this?
For what?
For your diabetes?
Oh.
Did they mention your type 1?
Yeah, insulin. I take insulin.
Okay. And then, any past medical history that can, like, be related to this?
I don't think so.
Okay. And, what was the last thing you ate, if you can recall?
Toast.
Okay.
Toast.
And what do you recall the last thing you were doing that led up to this?
Studying.
Okay, study.
Okay, we're taking our OPQRST history. Sir, how long ago did you lose consciousness?
What?
How long ago did you lose consciousness? Kelly, you said you were there with them. When did he?
About like 5 or 10 minutes ago.
5 or 10 minutes ago. Okay. Sir, is there anything that makes you feel worse or better? Anything hurt? No? Okay. Could you describe how you're feeling?
I'm just a little confused.
A little confused?
A little
Okay.
confused.
If you could rate it 1 to 10, do your best for me.
It's like a 9. Like a 9.
Okay, and then you said it was about 5 or 10 minutes ago he went out? Okay. All right, beginning our secondary assessment. I'll be doing the focused exam, going over our 5 body functions. Nadia's gonna start grabbing vitals. Sir? First I'm checking the neurological system. Sir, I'm gonna have you look forward and close your eyes for 5 seconds and then open them. Okay, patient's eyes reacted to the light. Moving on, we're gonna check the muscular. Nadia's gonna give the respiration.
The respirations, I got a 22, still shallow.
Okay, next we'll be checking patient's pulmonary system. So next, Nadia, how does the lung sound?
He has clear lung sounds, still a little shallow breathing, but we got respirations at 20.
We'll be checking his cardiac system now. So Nadia's gonna be grabbing blood pressure.
Can you see your arm, please, sir?
I'm gonna be grabbing his pulses. Just drop them at. Okay, first checking bilateral pulses. They're equal and rapid and weak. We're gonna be getting his pulse now. Okay, patient's pulse is 120. Nadia, the blood pressure is
I got 90/60.
90 okay, a little low. Gonna be moving on, checking our patient's blood glucose level. All right, next body system we're checking is the musculoskeletal. So I'm gonna, sir, take my hands here and crimp them. Now can you pull against me? Okay, give me your palms. You push against me. Okay, patient has control. Checking the last system, the integumentary system. The patient's skin is still pale, cool, and clammy.
I'm going to check his glucose levels. Wipe this clear real quick. I'm gonna do a little poke, sir. I'm gonna discard this in the sharps container. It is reading error, so I'm going to try this again. I got error again.
Okay, let me contact med control. Med control, we getting multiple error messages on our glucometer. We got a 25-year-old. He's kind of coming back too. We think he needs glucose. We have permission. And then,
You have permission to administer 15 grams of oral glucose.
okay, we got permission for glucose, Nadia, so if you want to grab that. We're going to make sure our 6 rights are in check. We have the right medication, right patient, right time, right dose, right route, and right documentation. So Nadia will start. We'll be doing 15 grams PO.
I'm going to be giving you 15 grams of glucose, sir, so just go ahead and put the mask down, and I'm going to put it in the inside of your cheek. Alrighty.
Alright, for our diagnosis, we had a patient suffering from hypoglycemia due to not taking his prescribed insulin medication. Hypoglycemia results from an imbalance where glucose utilization exceeds production. Our BLS treatment for this patient was giving him an NRB at 15 liters on high flow oxygen, and we also treated for shock by giving him a blanket, and then with med control's permission, we gave him 15 grams of oral glucose.
Alright, let's go over sexually transmitted disease.
Hey, you okay? You okay?
Something like that, and then we'll say okay, and then go into general impression, level of consciousness, or wait, general impression, prices, PPE, and scene safety, and then we're gonna. You got a patient running. Okay, so we get here, we have our PPE on. Scene is safe, and we're gonna be approaching the patient.
Oh my god.
Kelly, bro.
We need some more.
Whispered, oh my god.
Oh my god.
Okay, so we get to the scene, we have our PPE on. Scene is safe, and we're gonna approach the patient.
Oh my god! So, you fell unconscious.
There's no obvious bleeding, so we'll move on to A. Sir, He's patient's conscious again, or semi-conscious, but he's. Why is he smiling?
Toast.
Toast, last thing, okay. And then what were we doing when that led up to this?
So I'm gonna perform the pearl test, see if our patient's eyes react. If so, sir, if you can just look forward. Okay, patient's eyes.
Why are you just looking right at it?
He was looking at me.
Sir, are you doing okay?
Okay.
Ready? Go.